Hello, my name is Thomas Tribble. I'm with Abiomed, also with Johnson & Johnson NedTech. We're here to highlight the Impella 5.5 and also our Ecala as well. So with this, we want to highlight that the Impella 5.5 is for cardiogenic shock or cardiomyopathy. It's a surgical pump that can be placed direct, and so we have a direct model that's here. This uses a training tool that we can train clinicians, physicians as well. And also we have, it could be used for surgical cut down for the axillary artery as well. So it's a 21 French catheter that's placed in through the aorta or from the axillary artery that's there. We're just moving volume from the LV into the ascending aorta that's there to be able to create cardiac output. So we have a max flow of 6 liters of flow. It's mounted on a 9 French catheter, and it's controlled by a common console, AIC console. So with this, we have a direct model that we're here to be able to illustrate as well. And so we're placing a 2 millimeter graft. So whether it's direct or subclavian model, we're going to have a 2 millimeter woven graft that's going to be sewn onto the artery. And then we have a 23 French sheet that's in the back end of this, and also with a graft lock that's here. And now we can deploy the device, whether it's from the axillary approach or from a direct approach, which would be an open sternotomy, of course. So these are used for patients with low cardiac output syndrome or with a low EF that's coming in, maybe on high-dose inotropes, with other comorbidities such as suspect renal failure as well. So this will help these patients to be able to recover sooner and have a cardiac output afterwards as well. So with this, we can deploy the device right into the ascending aorta that's here. As we're coming off pump, we can come on Impella support, and we can supply up to 6 liters of flow with these patients. So for the post-op trajectory after these patients are about of surgery, the outcomes have proven that they've done a lot better, of course, because it can be extubated early, ambulated as well as they can continue to try recovery from their initial cardiac procedure. So whether it's a CABG valve or a CABG or for a valve as well, these patients do much better with that additional cardiac output support with that. So with that, I'll turn it over to Angie.
Hi, good morning. I'm Anjo, and in addition to what Thomas said, I'm going to highlight the benefits of utilizing Impella with peripheral VA ECMO. So right now, what we have here is an animation showing 5.5 utilization with VA ECMO, or we call it Impella. And research has shown that when you utilize Impella for VA ECMO LV unloading, it's shown that increases the likelihood of myocardial recovery by LV decompression. In addition to that, shorten your VA ECMO run. So we also have a training tool over here in conjunction with Harvey Loop, where you could simulate different scenarios. You could actually simulate scenarios, different cannulation strategies, and different kinds of Impella to see it unload, where you could see hemodynamic benefits and you could see the wedge pressure decreasing. We have handouts over here that shows the different pathways when you utilize CP and utilize 5.5 and all the patients that you should monitor for LV distension, like this, that low EF patients. And we also have case studies here that shows the Impella benefit. So with that, we do thank you guys for having us here, and look forward for a good meeting.
Thank you.